Well, it's a very important sector, healthcare, and you've seen a breakdown of the promises made by then candidate of the APC, Bola Tinubu, in his manifesto, the Renewed Hope Manifesto, prior to being elected president. So 1 year into his administration, how much have we seen these promises come into fruition? We're starting off with the immediate past president of World Medical Association, also the immediate past president Commonwealth Medical Association, as a past president Nigerian Medical Association, a fellow Nigerian Medical Association and chief consultant family physician, Dr. Osahon Enabulele joins us virtually from Benin City this morning. You're welcome to the program, Dr. Enabulele.
Good morning, Nigerians. Happy to be here again after a long time. Thank you.
Well, it's good to see you. I know we love our doctors, but you don't look forward to seeing doctors every day, because that usually means you'll have to go to the hospital, and it means that something is probably wrong. But this time, we are not diagnosing ourselves, but the health sector, based on the promises made by President Bola Tinubu. And in that manifesto, he described the healthcare sector as a matter of right and urgency. Let's pause on the right bit and look at the urgency, and I would ask you straight on, are you seeing a sense of urgency to begin with in this administration's approach to healthcare?
Yeah, thank you very much. First, to say that, let me just let you know that doctors are Nigerians. They are citizens of the world, and so it's not all the time you come to the hospital thinking that, oh, it's for diagnosis. There are issues of preventive care, for instance, just to keep you healthy and in a state of, well-being, to guarantee your well-being. So doctors are Nigerians, and they are friendly people. So don't be scared, of meeting a doctor. All right. Now, I think clearly Nigeria has always been in what I call a revolutionary situation in all sectors of its economy, including the health sector. And so there's no better time than now to re-emphasize that even within the health sector, there's obviously need for some level of urgency. I mean, because if you look at all the parameters, all the indicators, they're not very, alluring at all. And so any government that comes in must necessarily, undertake that kind of intervention to ensure that some level of, relief is, accrues to Nigerians. Because if you look at, for instance, the fact that a lot of Nigerians are living in, very pitiable levels of poverty, cannot afford healthcare, and look at even the skyrocketing prices of commodities now, healthcare commodities and all of that. Most Nigerians are still indulging in catastrophic health expenditures. So there's that level of urgency that is needed to say, look, how can we save Nigerians from further, undergoing this kind of hardships in the process of, guaranteeing their safety, their healthcare, their well-being? If you look at even the healthcare providers, how do we rescue the almost complete, in fact, virtual absence of practitioners, healthcare workers in some health facilities in the country? I mean, we are no longer, it's no longer news that in some hospitals, even big-time hospitals, you're having several departments being closed down because of the whole challenge of, the Japa syndrome, which is now, the whole brain drain phenomenon. So how do you talk about healthcare security? How do you talk about the safety and the security of healthcare workers who are even supposed to, be at the point of care, in terms of delivery of services at the point of care? So clearly, we have an emergency on our hands. And I think the government has gotten it right in terms of, committing itself, to, of course, undertake some level of rescue operations, if you like, to, of course, redirect the fortunes of the healthcare system and, of course, the whole, economy of Nigeria. But I think it's not enough to accept that reality. What has always been missing is to put, some level of action to all our, theoretical constructs and concepts. And so the need to walk the talk is what is important. And I think that should be our conversation today and even subsequently. That's beyond prescriptions. We've had these prescriptions before. We've had these admissions before. I mean, here in this country, we had a Secretary to Government of Federation publicly admit that he never knew that the decay, in the health sector was phenomenal, was phenomenal. I mean, now you admitted that. What has happened since that admission? I mean, so clearly Nigeria needs to have some level of urgent steps taken to attend to a lot of the levers, a lot of the enablers that, of course, will turn around the healthcare fortunes of our country.
So you have described what should be, but my question to you is that what is now? Do you sense that urgency just before Bukola comes in? Do you sense that urgency? I know that with medicine, there needs to be urgency. That's why you have emergency, you have all of those things. So do you sense that urgency from this Tinubu administration so far?
Yeah, I sense that urgency clearly, because a lot of the foundational steps have been taken by the government. First, like I said, I commend them for accepting that basic health care is a matter of fundamental rights and, of course, a matter of long-term security. That is only to emphasize the provisions of the National Health Act as guaranteed in Section 3, subsection 3, which, of course, obligates government to provide healthcare services, at least a basic minimum package of healthcare services to Nigerians. So clearly, I appreciate the kind of urgent steps they're trying to take, but they are still foundational. What I'm saying is that beyond these foundational steps, in terms of emplacing the policies, the frameworks, the mechanisms, Nigerians are in a hurry to see these mechanisms giving some level of push in terms of implementation. And I think that will make the difference between this, the narratives we've had in the past and the narratives we're now having. So once they're able to put action to a lot of these policy frameworks, then Nigerians can begin to see a difference. Right now, I can only say, yes, I sense some level of urgency, but whether that sense of urgency will translate into actionable steps, into positive outcomes, into population health, I cannot say for now, because this is just 1 year of the 4-year tenure of this government. And of course, clearly, a lot still needs to be done to make sure that Nigerians move away from this whole idea of developing policies that remain in their drawers, remain in the cupboards, and of course gather dust, with us coming back again 10 years after to, of course, dust those spies and the same seesaw vacillations that have characterized, past regimes. So I think clearly that is the difference we need to see. Right, so how do we put these policies into action?
So let's take a look at those policies and do a proper breakdown. And I'll begin with a very vital one: primary and secondary healthcare. In the manifesto, the promise made by President Bola Tinubu, this is what he said: deploying adequate infrastructure and human resources to address maternal and child care, immunization, managing preventable diseases. Now, that's a summary of the promise he made in that Renewed Hope manifesto regarding, the primary health care and secondary health care. 1 year into the office or into the administration of this government, we've had some reports across board from primary healthcare centers to secondary healthcare centers, and they leave much to be desired. Is that what you also see when you look across board, particularly primary and secondary healthcare?
Yeah, certainly. Primary healthcare remains the bulwark of any healthcare system. Sooner than later come to its peril. So every government needs to place emphasis on primary health care, but how you do it is also different. So I clearly appreciate the decay that is preeminent all across the country in terms of the primary health care. But we now say that primary health care is virtually non-existent in most of our states across the country. But I do not, deny the fact that some state governments are doing their bit to see how they can revitalize primary health care, because actually primary health care remains within the jurisdiction of the local government administration. Even though now most of the state governments have taken over that level of intervention for primary health care. So, but I think what is real is that we still lack, very vital, very functional, operational primary health care systems across the country. And that needs to be really, really engaged, because like I said, there's a linchpin. A primary care system is a linchpin of the healthcare system. It's the bulwark of the healthcare system. And so once you get it right, in terms of not only the infrastructure, but of course the component parts, the human resource, that needs to, of course, drive processes within those facilities, then of course you can begin to, of course, say that you inching towards a very robust, strong healthcare system. Because again, along with that is the need to, of course, revitalize the general hospitals, the state government hospitals, and of course, hoping that the federal government will do its own bit to put more emphasis on how to, of course, develop specialist care at the tertiary level. So it's a concatenation of processes. They are all interlinked. So if you emphasize interventions in one aspect without also doing others pari passu, then of course you may not be able to get that kind of robust healthcare system that you want to have, because the national healthcare system is a concatenation of these pieces and these subsets. And of course, I think emphasizing on primary healthcare, which actually should attend to over 70% of the disease burden of citizens anywhere in the world, in any nation, is currently not doing that. A lot of cases are going to the tertiary healthcare centers because people are no longer confident to procure healthcare in the primary healthcare centers. Some of them are extremely dilapidated. They lack the component staffing, and of course the equipment are not there. And that is supposed to be a forum and avenue for integrated care. Integrated care in the sense that every other condition that you have, some level of basic attention can be given at that level, even prevention, even promotion, health promotion. And of course, all of that, vaccinations, are driven through the primary care system. So there is no better time than now to see how we can bring up that level of care to a level where it can begin to, of course, attend to most of the disease burden that Nigerians are currently grappling with.
Indeed, Dr. Enabulele, and it may seem that the federal government is in acknowledgement of the state of primary health care systems in the country. And I'm going to be following up on that. But in the meantime, let's welcome Jeffrey. Jeffrey joins us now. Finally, Jeffrey, it's good to see you.
Let's go to Dr. Enabulele. What would be your rating?
Yeah, thank you very much. If I were to use the fact that they profess that within the first 2 years, they will cover 40% of Nigerians will be covered by health insurance. Right now, we have less than 7% of Nigerians covered on health insurance. So you can do the mathematics. So clearly, I will score them 35%, for now. That is not to say that the foundational steps have not been taken, but we hope in the second year we'll begin to see some manifestations of all the pronouncements and narratives and the roundtable workshops and all of that.
Well, we look forward to manifestations. After all, maybe that's why it's called a manifesto. But we'd like to thank you so much, gentlemen. Dr. Osahon Enabulele, immediate past president, World Medical Association.